Let's have an honest and direct conversation about men's sexual health after the age of 60. Today, I want to address a topic that has long been misunderstood, avoided, or treated with unnecessary silence: masturbation. Often viewed as a taboo subject, masturbation is in fact a vital aspect of male health and overall well-being, particularly as we age. For too many men, decades of misinformation or embarrassment have left them without the guidance they need to manage this natural and important activity safely. This video is designed to change that. My name is Dr. Harold Bennett, and as a urologist, I firmly believe that clear, medically sound information is the foundation of a confident, healthy life at any age. In the next segment, I will provide a comprehensive guide to masturbation for men over 60, explaining safe techniques, common mistakes, and warning signs that indicate it's time to seek professional medical advice. By understanding and embracing this aspect of your health, you are taking proactive steps to maintain not only sexual function but also overall vitality, circulation, and mental well-being. We will structure this discussion into 3 key areas. First, I will outline the 5 core principles of safe self-pleasure after the age of 60. Second, we will examine the most common mistakes that can cause physical or psychological harm. Third, I will cover the critical red flags that should prompt a visit to a healthcare professional. It is important to acknowledge that your body at 65 or 70 is not the same as it was at 25. Recognizing and respecting these changes allows for a healthier, safer, and more rewarding approach to sexual activity. The first principle is simple yet crucial: listen to your body's new language. After 60, it is normal for erections to be less firm, for arousal to take longer, and for stimulation to require more direct and focused attention. These changes are primarily due to natural shifts in blood flow, nerve sensitivity, and hormonal levels. Frustration, stress, or impatience only interfere with the physiological processes that make erections possible. Stress, in particular, is a well-documented inhibitor of sexual function. Instead of forcing the body to respond as it did decades earlier, cultivate patience and curiosity. Explore what feels pleasurable now without comparing it to past experiences. By tuning into your current bodily cues, you can maintain sexual function safely while enjoying a fulfilling, low-pressure experience. The second principle emphasizes the importance of lubrication. As men age, penile skin becomes thinner, drier, and less naturally lubricated due to declining androgen levels. Without sufficient lubrication, friction can cause microtears, chafing, and even infections. Using a high-quality, water-based lubricant is essential. Avoid scented products or novelty additives which can irritate sensitive tissue. Apply liberally. This simple step protects the penis from physical damage and ensures a comfortable, pleasurable experience. Proper lubrication also supports longer-lasting stimulation and reduces the risk of injury, making self-pleasure not only safe but more enjoyable. Third, create a sanctuary rather than treating masturbation as a race against time. Privacy, relaxation, and emotional safety are paramount. If you are anxious about interruptions, trying to hurry, or performing under self-imposed pressure, your nervous system remains in a sympathetic, stress-dominated state. This physiological response directly inhibits erections and reduces overall satisfaction. Find a time and place where you can be fully relaxed and undisturbed. Treat the act with the same respect you would a formal self-care ritual. This approach transforms masturbation from a hurried habit into a therapeutic, health-promoting activity. The fourth principle shifts focus from performance to experience. Many men grow up believing orgasm is the ultimate objective. After 60, however, prioritizing the journey over the destination provides profound physiological benefits. Slow down, explore varied forms of touch, and enjoy the sensations themselves. Regular, pressure-free sexual activity promotes healthy blood flow, maintains nerve sensitivity, and keeps the penile tissue flexible and responsive. In essence, masturbation becomes a form of functional therapy for sexual health, supporting circulation and nerve integrity. Fifth, engage your brain. The central nervous system is the most powerful sexual organ. Anxiety, outdated shame, or stress can inhibit sexual function at any age, but these effects become more pronounced later in life. Use masturbation as a practice in mindfulness and self-acceptance. Focus on sensations, breathing, and the present moment. This not only improves sexual response but also enhances mood, reduces stress, and strengthens the psychological connection to your own body. Mindful masturbation after 60 fosters both physical and emotional well-being. With the foundational principles established, it is equally important to recognize common mistakes that can undermine safety and pleasure. First, avoid the death grip, a habitual, overly firm hold developed over decades. This can desensitize nerve endings, delay ejaculation, and reduce satisfaction during partner sex. The solution is to vary grip, reduce pressure, and incorporate lubricant. Retraining the penis to respond to a wider spectrum of sensation. Second, maintain proper hygiene. Always wash hands and genitalia before and after masturbation. Neglecting hygiene increases the risk of urinary tract infections, balanitis, and other bacterial complications. Simple, routine cleanliness significantly reduces these risks. Third, never force an erection. Attempting to bend or rigidly manipulate a partially erect penis can damage delicate vascular tissue, sometimes leading to Peyronie's disease, a painful curvature caused by scar formation. Respect your body's current responsiveness and avoid aggressive techniques. Fourth, avoid unsafe tools or improper lubricants. Household objects, soaps, lotions, and petroleum-based products can cause injuries or disrupt natural pH balance. Use only medically recommended items designed for sexual use. Ideally water-based lubricants. Finally, release shame. Viewing masturbation as illicit or embarrassing fosters avoidance, stress, and unsafe practices. Recognizing it as normal, beneficial, and health-promoting is foundational to safe and satisfying sexual activity. Red flags are crucial to recognize. Persistent pain during arousal, ejaculation, or a constant ache in the penis, testicles, or perineum may indicate infection or structural issues. Blood in semen or urine, sudden erectile difficulties, new curves in the penis, unexplained lumps, sores, or a sudden drop in libido all warrant prompt medical evaluation. While not every issue is serious, early detection allows for effective intervention and peace of mind. Aging does not diminish the value of sexuality, it simply changes its expression. Safe, mindful self-pleasure supports circulation, maintains nerve function, and enhances psychological well-being. By following expert guidance, practicing hygiene, using lubrication, and engaging the mind, men over 60 can maintain sexual function, prevent injury, and enjoy fulfilling experiences. These practices, combined with medical awareness of warning signs, provide a framework for sexual health, confidence, and independence in later life.